2024. And I will also tell you a little bit about the anticipated programs or activities that we would want to run in the next 12 months. So it is a great pleasure that we converge here to discuss about our association, and this is what we call the annual general meeting, because the Congress has been conducted last year, and as far as Association of Health Journalists Constitution is concerned, the Congress happens every 3 years. Unless we have a gap, someone has left the position, then we can, just like we do in the country, we can organize a by-election and other things to fill in that position. But today our gathering is to talk about ourselves, our association, and also talk about two key important issues. One would be tempted to ask why HIV and AIDS and why gender-based violence, because they are not the only topics when it comes to health and nutrition in the country. But we all understand, as journalists working closely, the journey we started quite often, if you are a new member, to look at some of our achievements that we have made as an association, but as well to look at the challenges that we are confronted with on a daily basis. It was also a moment to chart the way forward, because we want to get bigger and stronger. Distinguished guests and colleagues, it's exactly 1 month this year when the 4th Executive Council of the Association of Health Journalists took office. Last year, on the 17th of December, we conducted an elective Congress, and some of us you are seeing in the Ashubi are the ones who were elected to take up the mantle of this leadership. So since then, 12 months, we have been working tirelessly to fulfill the key mandates of not just coordinating activities of this association, but as well to lobby for training opportunities for the members and even for ourselves. So to continue on where the former administration has stopped, we have challenged ourselves to take up the task. At this juncture, I want to say that when this 4th Executive Council was taking over the Association of Health Journalists, it wasn't easy. So it's unfortunate for us as an executive, because we did not enjoy that smooth transmission that the former executive members enjoyed. But then with the capacity and expertise among ourselves, we started at a very rough ground. But today we are delighted that at least we have come this far, to this moment of organizing something where we can discuss with our members. So therefore, for the past 1 year, despite we did not inherit any financial record or other activity records, we have tried to put in something into our coffers, which our able treasurer will talk about later on. So we have also tried to reconnect to our traditional partners, because at some point, like Yusufa said, some of them were asking, what is going wrong with the Association of Health Journalists? Because they knew the association has ever been vibrant. They tried to get to people who they know were there so that we can form ourselves to come back to the sound footing. So when we had the administration formally in place, the first thing that we did last year was to knock on the doors, the partners that we have been working with, because at that moment we did not have any activity, we did not have an action plan, so we wanted to start. The first door that we knocked, because every human being or every administration has a structure, and for us, the first door that has ever been opened for us, that has been our key partner, is the Health Promotion and Education Directorate of the Ministry of Health. So we decided as an executive that we were going to meet them. After courtesy call to different institutions, including EPI, on the 10th of January 2024, the Association of Health Journalists had its first engagement. That was a training for 15 of our members. And these members were capacitized on gender-based violence by a new partner that is also called Sign Light in Girls' Education. During that training, we were privileged to have one of our veterans, who is Uncle Serin, to take us through some of the good reporting skills that we could explore, not just on gender-based violence, but even on all other issues that concern health. So the training was also fruitful. We had a good time. And on the 1st of February, I can vividly remember, African had a stakeholder meeting, and myself and Big Sam were part of those who went to that meeting. We discussed with them about the initiative, Good Nutrition Starts With Me. After that discussion, we formed a group, a working group, which supported African to provide certain training and also identify certain training materials.
Always make sure that you get your facts right, and make sure that you consult. You should not allow your professional duties to be influenced by anything, because trust is the foundation of journalism. Truth and accuracy in broadcasting or in the print media is very important, so establish your impartiality in your reporting. And you should try also to identify yourselves and your employers, and also you should respect, when you are reporting, the privacy of people, and also try to respect their rights. Because sometimes in reporting, especially when it comes to health reporting, you want to dig deep into somebody's private life, and that could also lead to something else. Remember that yours is one that is noble and is one that should be carried out with patience and also investigations. I was a member of the AOAJ, and I still think I am part of you.
Well, the AGM is a significant milestone in the calendar of the AOAJ since its inception in 2001, because it has not been held before. This is the first of its kind. We can say it's the maiden Congress since the establishment of the association, because we felt the need that health has been underreported or never been reported. Or we can say that health issues, most especially the nutrition and the tobacco and health related, are misrepresented in many mediums, because we are only focused on governmental agencies, news agencies, and all the human interest stories. But health is left behind, and we felt the need to revitalize, to address the needs and aspirations of people to know and to be educated on health important issues in this country. Because we selected this theme on the basis that it is a growing trend, and also we feel that there is need to devise new strategies as a new paradigm shift to ensure that gender-based violence is eradicated in this country. Because if you go to many households, gender-based violence is a norm now. And we need to eradicate that norm and better educate, inform the public about the effects and the dangers of gender-based violence, because it is a deterrent as a nation when we are seeing a growing number of gender-based violence that are not being addressed or unanswered at the borders of inquiry. And then we, the health journalists, we believe that it is part of our mandate to ensure that gender-based violence, we collaborate effort to educate the public about the effects, because the world is moving now, and we need to move. And Gambia now, we are far left behind when it comes to tackling gender-based violence and other health problems issues in this country.
It just seems